A Santa Rosa man is in a dialysis dilemma. He says the state used to help him pay for transportation to get his treatments.
Yeah, he called 5 on your side when the help stopped coming. Channel 5's Gabriela Garza finds out why and what other options are out there to help him.
Delfino Mendoza pays more than $100 every month traveling back and forth to his dialysis center in Weslaco. He says the gas mileage reimbursement checks help relieve some of the cost. Every week, Delfino Mendoza will make the familiar drive from Santa Rosa to Weslaco, a drive he makes 3 days a week. His health depends on it.
I've been on dialysis for 18 years.
Mendoza says the weekly visits are pretty costly in more ways than one.
Since we go to dialysis 3 times a week, I mean, they help us with gas, the little bit the state can help us with.
He's a part of the Kidney Health Care Program. This is a program designed by the Department of State Health Care Services to help people receive benefits such as dialysis treatments, access surgery, medicine, travel to health care visits, and Medicare premiums.
My only income is just Social Security because I don't work because of my disability. But I wish I would. I wish I would because it is very hard and difficult.
Mendoza says recently he noticed an issue with the checks.
It's always a month behind, okay, which is fine, we can understand. So the check that I should have received in January is for December, or the one for March is from February, but the scenario now is getting worse.
Today, Mendoza says he called to the state program to try and get some answers.
30 minutes for me to get through. The lady answered the phone after I told her that I needed to speak to someone regarding this issue. She hung up on me.
We spoke with Christine Mann with the Department of Health Human Services Commission. We wanted to find out what happened to Mendoza's benefits. Mann says she is looking in their system to look over Mendoza's file. She says both the January and February mileage checks have been mailed out.
This is happening to me. Can you imagine to elderly people that are going through this, that know how to speak English? They don't know. Who do they talk to? Who can they speak to regarding these issues? If I have this issue, can you imagine them?
Mendoza says he will continue to make his weekly trips to the dialysis center with or without a check. We will continue to follow Mendoza's story and work with the Department of Health and Human Services to find out what may have caused this issue. If you find yourself in a similar situation and need help, you can contact Texas Medicaid Program at 1-877-541-7905 or the Texas Renal Coalition at 512-441-3444. In the Channel 5 studio, Gabriela Garza, Channel 5 News at 6.